You know, for the past several years, we have found all the great services that Coastal Family Health here does for South Mississippians. And, you know, they've got so many different programs that we visited, you know, when it comes to kids, you know, even just, you know, general practitioners. And today on the show, we're talking to Nick Rutledge, who is the program manager for integrated behavioral health with Coastal Family Health. How are you?
I'm good.
Good to see you.
Good to be here.
Tell us, if you would, first, a little bit about yourself.
So I am a licensed clinical social worker. I've been with Coastal Family Health for about the past 2 years. And a lot of my experience has been in the areas of the integration of healthcare and social work.
Okay. And if you would, tell us a little bit about Coastal Family Health. I know there's several locations.
We have many locations. We have about 12 clinics, 2 pharmacies, 9 school-based sites across the 6 counties of coastal Mississippi. We provide a wide variety of primary care, dental, optometry services, as well as pharmacy services, and we have a behavioral health program to serve our patients as well.
And a prenatal care with that. I know we've been across, across the parking lot.
Across the parking lot, that's exactly correct.
For all the prenatal and you know, baby care and all
Pediatrics,
that.
yes,
Pediatrics, and everything. So you really do cover a wide spectrum of services when it comes to medical services for people of all ages, from you know, before they are born on up to you know, mature adults. Talk to us about integrated behavioral health. What exactly is that?
So integrated behavioral health is essentially a care model that co-locates primary medical care with behavioral health services. And care providers are on care teams essentially working together to provide a collaborative sort of whole person care model for the patient. It's advantageous in a number of ways. It's another way that we sort of are able to provide a one-stop shop type service at many of our clinics here at Coastal. So people can come and receive their primary care services, behavioral health services on the same day, and have those providers work with one another and communicate and collaborate for the better care of the patient. Now,
primary care, of course, we're talking about just general visitation for your doctor or anything like that. You got a cold or you know, that you need to deal with. You know, just a regular visit, a wellness checkup, things like that. Behavioral health, though, I mean, that gets a little bit deeper into things than, you know, when you hear about people with behavioral health, you think people with behavioral issues and things like that. And what kind of issues do you see?
It ranges. In primary care, we see high levels of depression and anxiety in our patients. Coastal is unique in a couple of ways. We are a level 3 certified patient-centered medical home through the National Center for Quality Assurance. We also recently received accreditation through the Joint Commission on the Accreditation of Healthcare Organizations, commonly referred to as JCAHO, for both our ambulatory healthcare and behavioral health programs. As part of those sort of quality markers, those marks of success, there are a number of sort of standardized ways that we go about caring for every patient that comes through the door. One of those ways is to make sure, for example, with an annual wellness visit, to make sure that every person who comes in for whatever reason receives a depression screener. We call it a PHQ-9, Patient Health Questionnaire 9. And so essentially every time a patient comes through the door, they're answering questions about their behavioral health, their mental status, their depression, their anxiety. So even if you might be coming in for a cold or a blood pressure check or whatever, you might have something going on in your life that, you know, is causing you a hard time. People are stressed out these days. There's a lot of sort of
telling me
chronic toxic stress out there, traumatic stress, and so
that can be attributed to work, could be attributed to family.
Absolutely,
there's so many different
things. And you know, we're kind of unique on the coast because it seems like every couple of years we are subject to some type of environmental crisis that can precipitate a lot of what's going on and what we see in our patients and in our communities. So we're very diligent about making sure that every patient that comes through the door is assessed fully, comprehensively, and appropriately. So regardless of what you're coming in for, you know, we can identify areas where people might be in need of additional services.
So as you said, you may be just coming in for a wellness checkup. You got a cold or something like that. But y'all take it a little bit further, as you said. You sit down and talk, well, how's life been treating you?
Exactly.
How are they? What are some of the things that you've been dealing with? Or are you having some problems, you know, at home or work that, you know, and 9 times out of 10, as you said, depending on what's going on in the environment, they'll finally say, yeah, well, yeah, I've just been really depressed. You know, this whole thing with the monetary spillway.
Exactly.
You know, and the way it's hurt the seafood industry down here. You know, not to mention the health. You know, can't take the family to the beach because afraid of health issues. So it can really come out in so many different ways.
Absolutely, and because our providers and our nurses are so good at sort of picking up on some of those things. They know their patients anyway. A lot of these folks know what their patients are struggling with. But we also have some measures of what we call social determinants of health. So we're always assessing for housing insecurity. What's your living situation right now? Food insecurity, income insecurity. And if providers are identifying areas that they can't necessarily address medically, well, there's a behavioral health professional right next door. When we finish here today, I really want you to sit down and speak with him or her, and let's chat and see if we can come up with some ways to be supportive of your situation. And we find that patients really love it. We find that providers love it. And the research supports that the integration of behavioral health, co-location of those services, has positive impacts on health outcomes. It decreases doctor's visits. It decreases visits to the ER. It's just advantageous in a number of ways.
And do you find that it's easier to work with them close like that than saying, here's a prescription, just go take this, go take this stuff?
Absolutely.
A lot of people get dependent on pharmaceuticals or whatever to help them deal with their stress.
And that's one thing I think our providers appreciate. I have, I guess there are about 9 behavioral health specialists in my program, and we cover all 12 of our clinics. So every provider has access to a master's level behavioral therapist. So, you know, if they're not quite sure if this is really a medication issue or if this is a therapy and counseling issue, they can go and consult on that patient. If they have a problem or question about a medication, they can work with behavioral health to consult on that patient. We have recently added psychiatric services to our sort of suite of behavioral health services. We have a psychiatrist and a psychiatric nurse practitioner at our clinic in D'Iberville. And so that is a referral source for us if people do need those types of medications that aren't typically prescribed in primary care. Yeah, it's just all around a good shop.
Well, we're about to run out of time, but thank you so much
Yes,
for
sir,
your time.
absolutely.
You want some more information, call the number on your screen. Find out how they can help you at Coastal Family Health.